Imagine restoring sight using a patient's own tooth. That's the essence of Osteo-Odonto-Keratoprosthesis, or OOKP, better known as tooth-in-eye surgery. This radical procedure is a last hope for those blinded by severe corneal damage, where all other treatments have failed. Surgeons extract a tooth and a bit of jawbone, crafting them into a living frame to hold a tiny plastic lens. This structure is implanted into the damaged eye, creating a new permanent window for light to reach the retina. Using the patient's own tissue reduces rejection, making OOKP uniquely effective for the most desperate cases. For people living in darkness after catastrophic injuries or diseases, OOKP offers a chance to see again when every other option is gone. It's a testament to medical ingenuity, turning a tooth into a new window to the world. OOKP isn't for everyone. It's reserved for those with end-stage corneal blindness, where the eye's surface is so scarred that even donor corneas fail. Candidates have often suffered chemical burns or rare autoimmune diseases like Stevens-Johnson syndrome, leaving their eyes sealed by scar tissue. When the body rejects all other transplants, OOKP bypasses the damaged cornea entirely, creating a new path for light. This surgery is a last resort, chosen only when permanent blindness is the alternative. For these patients, OOKP is more than a procedure. It's a lifeline, restoring the ability to see loved ones and experience the world again. The journey is complex, but for a select few, it brings hope where none existed. OOKP stands as a symbol of perseverance and innovation in the face of impossible odds. The genius of OOKP lies in using the patient's own tooth and jawbone to anchor a new lens. Teeth are chosen for their strength and compatibility. Unlike donor tissue, the body accepts its own. Surgeons extract a tooth, shape it with a piece of bone, and drill a hole for a clear plastic lens. This lamina is temporarily implanted under the skin, where it becomes living tissue through vascularization. Once ready, it's moved to the eye, providing a stable, blood-supplied home for the lens. This approach overcomes the rejection that plagues artificial corneas in damaged eyes. By merging dentistry and ophthalmology, OOKP transforms a tooth into a gateway for sight. It's a remarkable example of biocompatibility, using the body's own resources to restore vision. OOKP unfolds in two major surgeries, months apart. First, a tooth and jawbone are extracted, shaped, and fitted with a lens, then implanted under the skin to develop a blood supply. Meanwhile, the eye is prepared, scar tissue is removed, and a cheek lining graft is placed over the eye. After the lamina is fully vascularized, it's retrieved and implanted into the eye, replacing the damaged cornea. The cheek lining covers the eye and implant with only the lens tip exposed. After healing, a small opening is made in the graft, allowing light to pass through the lens to the retina. For many, this is the first glimpse of light in years. The staged process ensures the implant is accepted and vision is safely restored. It's a meticulous journey, but the reward is life-changing sight. OOKP is reserved for those with the most severe, untreatable corneal blindness in both eyes. Ideal candidates have suffered irreversible damage from burns or autoimmune diseases and have no hope with standard transplants. They must have at least one healthy tooth and cheek tissue for grafting, and their retina and optic nerve must still function. Good general health and psychological readiness are essential. This is a demanding, lifelong commitment. The procedure doesn't fix damage to the retina or optic nerve. It simply creates a new window for light. Patients must be motivated and able to follow strict post-op care to protect their new sight. Selection is careful and multidisciplinary, ensuring only those who can truly benefit undergo this transformative surgery. For the right patient, OOKP offers a return to the world of light. In 1960s Italy, Professor Benedetto Strampelli faced the impossible, restoring sight to patients blinded by corneal disease. Corneal transplants failed, and artificial corneas were often rejected. Strampelli's radical idea: use a patient's own tooth as a natural anchor for against all odds, he restored vision, proving a living window into the eye was possible. Strampelli's innovation laid the foundation for modern sight-restoring surgery. Professor Strampelli's original one-stage surgery was groundbreaking, but long-term results were unpredictable. The real breakthrough came in the 1990s, when Professor Christopher Liu introduced a two-stage approach. First, the implant is placed in the patient's cheek to develop a blood supply, then moved to the eye. This innovation made the procedure safer, more reliable, and gave hope to patients worldwide. Following the crucial development of the two-stage technique, the evolution of Osteo-Odonto-Keratoprosthesis entered a new phase of refinement and standardization. The procedure, once considered a radical experiment, began to establish itself as the gold standard treatment for the most severe cases of end-stage corneal blindness. Specialized surgical centers, most notably in the United Kingdom, Italy, and Germany, began to accumulate more experience, meticulously documenting their outcomes and fine-tuning every aspect of the surgical process. This collaborative effort led to incremental but significant improvements in patient selection, surgical instrumentation, and post-operative management, further enhancing the safety and efficacy of the procedure. One of the key areas of advancement has been in the management of post-operative complications, especially glaucoma. Glaucoma, a condition involving high pressure inside the eye that can damage the optic nerve, is the most common threat to long-term vision after OOKP. Surgeons and ophthalmologists developed better protocols for monitoring eye pressure and more aggressive treatment strategies, including the preemptive placement of glaucoma drainage devices during the OOKP surgery itself. These proactive measures have been crucial in preserving the sight that the surgery so miraculously restores, ensuring that the visual gains are not lost to this secondary complication over time. Furthermore, improvements in imaging technology and surgical tools have allowed for greater precision at every stage. High-resolution CT scans help surgeons select the best possible tooth and plan the extraction with pinpoint accuracy. Microsurgical instruments and advanced operating microscopes enable more delicate handling of the tissues, reducing trauma to the eye during the complex implantation process. Even the materials have evolved with ongoing research into new polymers for the optical cylinder that are even more biocompatible and resistant to clouding over the decades that patients will rely on them for sight. Today, OOKP stands as a mature and highly successful, albeit rare, surgical procedure. It is a testament to decades of innovation, from Strampelli's initial bold vision to the critical refinements of the two-stage approach and the continuous improvements of the modern era. It is no longer an operation of last resort performed in desperation, but a carefully planned and executed reconstructive journey that offers predictable, life-changing results. For that very specific group of patients with the most devastated eyes, OOKP has evolved from a hopeful experiment into the most reliable and enduring solution for restoring sight, a true pinnacle of medical ingenuity. Osteo-Odonto-Keratoprosthesis, or the tooth-in-eye procedure, has restored sight and life to people like Ian Tibbets and Martin Jones, who lost their vision to devastating accidents. After years of darkness, they saw their loved ones again, reconnecting with family and rediscovering the world. Their stories show that OOKP is more than medicine. It's about hope, human connection, and a window to life reopened. OOKP restores not just sight, but independence and the joy of simple pleasures. Walking to the shop, reading, or watching a sunset. These everyday moments, once lost, become extraordinary milestones. Patients regain confidence, reconnect with loved ones, and rediscover the beauty in daily life. The true power of OOKP lies in giving back these small, vibrant joys that make life meaningful. Beyond moving personal stories, the success of Osteo-Odonto-Keratoprosthesis is backed by impressive clinical results. OOKP restores functional sight, often allowing patients to recognize faces and navigate independently. Many achieve a visual acuity of 20 or 60 or better, a life-changing improvement. Quality of life surveys show dramatic gains in independence and well-being. OOKP is a reliable transformative surgery, turning hope into a visible reality. While osteo-odonto-keratoprosthesis can restore sight, it comes with significant risks. Glaucoma, infection, and implant instability are serious threats that require lifelong vigilance. The decision to proceed is made with full understanding of these challenges. The potential reward of sight is weighed against the real possibility of complications. Success depends on a strong partnership between patient and medical team. Recovery from OOKP surgery marks the start of a lifelong commitment to specialized care. Patients must follow a strict regimen of eye drops and regular checkups to protect their vision. Daily diligence, using medications, cleaning the eye, and attending appointments is essential. This dedication helps patients preserve their sight and enjoy a world full of light. Regaining sight after years of blindness is both exhilarating and disorienting. The brain must relearn how to process a flood of visual information, and the world can feel overwhelming at first. With patience and support, patients adapt to tunnel vision, learning to scan their environment and embrace a new perspective. For many, restored sight is a second chance, met with gratitude and awe. The Osteo-Odonto-Keratoprosthesis is only possible thanks to a multidisciplinary team. Ophthalmologists, oral and maxillofacial surgeons, anesthesiologists, prosthodontists, nurses, and rehabilitation specialists all play vital roles. Their seamless collaboration, bridging eye, dental, and surgical expertise, transforms a complex procedure into a life-changing restoration of sight. It's this dedication and teamwork that make OOKP a reality for patients. The OOKP procedure remains the gold standard, but surgical teams worldwide are refining techniques for better outcomes and fewer complications. Innovations include improved graft management and more delicate microsurgical tools. Proactive glaucoma care like drainage devices protects vision. Advanced diagnostics and data-driven patient selection make this life-changing surgery even more reliable. The OOKP procedure uses a patient's own tooth, but not everyone has a suitable one. Now, researchers are developing synthetic and donor-based implants that encourage the body's own cells to grow in, creating living integrated devices. These breakthroughs could soon restore sight to even more people, building on the legacy of the tooth-in-eye surgery. Osteo-Odonto-Keratoprosthesis, the remarkable tooth-in-eye surgery, stands as a powerful testament to human ingenuity. Specialists from different fields turn a piece of the human body into a window to the world. For patients with severe corneal blindness, OOKP offers lasting hope. It provides a pathway back to sight when all other avenues have been exhausted. From Professor Strampelli's idea in the 1960s to today's refined technique, OOKP showcases medical progress. The procedure's evolution is driven by understanding the body's ability to heal and integrate its own tissues. Using a patient's own tooth and bone, surgeons create a living implant. Biointegration is key to its success, providing stability and longevity. OOKP is a partnership with the body's own biology. The procedure's impact extends beyond restoring sight. It restores connections, independence, and the joys of life. Patients can see their children's faces and navigate their world. The path is demanding, requiring lifelong care and vigilance. It allows patients to see a sunset, read a book, and re-engage with the world. Each successful surgery is a victory against blindness. OKP has carved out a unique and inspiring chapter in medical breakthroughs. Extraordinary solutions are found in unexpected places, like a simple tooth. With courage, collaboration, and innovation, we push the boundaries of what is possible. The tooth and eye surgery is a profound symbol of hope, demonstrating that even from the deepest darkness, a path to light can be forged through brilliance, skill, and sheer human determination. The story of Osteo-Odonto-Keratoprosthesis is far from over. As dedicated teams continue to refine the surgical technique and improve long-term care, the future for patients with end-stage corneal disease looks brighter than ever. Ongoing research into new biomaterials and tissue engineering holds the promise of one day developing implants that can offer the same biological stability as OOKP, without the need for a tooth. These next-generation devices, inspired by the principles of OOKP, aim to expand access to sight-restoring surgery for an even wider group of patients, bringing hope to those who may not be candidates for the current procedure. The spirit of innovation that sparked OOKP continues to drive the field forward. The unwavering commitment of the multidisciplinary teams who perform this surgery ensures that OOKP will remain a vital tool in the fight against blindness for years to come. Their collaborative work, combined with the courage and resilience of their patients, is what makes these medical miracles happen. The continued sharing of knowledge between specialized centers around the world helps to standardize best practices and improve outcomes for everyone. This global effort is a testament to the medical community's dedication to solving the most difficult challenges in ophthalmology and giving every patient the best possible chance to see again. It is important to remember that the information shared here is for general knowledge and to inspire awe at the progress of medical science. It is not a substitute for professional medical advice. If you or someone you know is facing vision loss or any other medical issue, the most important step is to speak with a qualified healthcare professional. They are the only ones who can provide an accurate diagnosis, discuss your specific circumstances, and guide you through the treatment options that are right for you. Always seek expert advice for any questions or concerns about your health. Ultimately, Osteo-Odonto-Keratoprosthesis is a story of hope. It is a powerful reminder that even in situations that seem utterly hopeless, scientific progress and human perseverance can create extraordinary possibilities. For the patients whose lives have been transformed, it is a second chance at a life filled with light, color, and connection. The journey is a testament to the incredible resilience of the human spirit and the remarkable ability of medicine to restore not just function, but the very quality of life itself. The future is indeed bright, illuminated by the ongoing quest to conquer blindness.